My name is Stephanie Arnold. I am a consultant dermatologist at the Oxford University Hospitals, mainly working at the Churchill Hospital. Well, it wasn't until I was at university that I actually decided to pursue a career in medicine. I had started studying science, and that had always been my passion since I was a little girl, really. And I was really loving learning about science, but the practicalities of being a researcher were, it just didn't gel with my personality and the type of work I wanted to do. I wanted to see results fast, and I wanted to see science being used in a practical way. And so I cast around for how I could use science and landed in medicine, really. Um, and looking back, I can see that actually I use science every moment of my working day. Science helps me deliver diagnoses and to make treatment plans with my patients, but also medicine allows me to use that science straight away and with the patients in front of me every day. And that's really why I chose medicine. Hmm. Well, I feel so lucky that I chose dermatology. It didn't come to me straight away to that I wanted to be a dermatologist. I I wanted a career where I had variety, and whether that was both variety in the types of people that I was helping and seeing, but also variety in the sorts of things I was doing at work every day. And dermatology is just the perfect fit. Everybody has skin, obviously, and everybody needs some. Almost everybody will have something wrong with their skin at some point in their lives, whether that's as a baby with eczema or as a very elderly person with skin cancers. And so I loved that part about dermatology, that I get to treat everybody at every stage of their lives. Um, I also love the variety of dermatology. I get to chat to patients, have consultations. I get to prescribe medicines, tablet medicines, as well as creams. But also, I get to do treatments on patients. So I operate on skin cancers. I use lasers and other devices to treat other skin problems. And so, no day in my job is the same. No patient is the same, and that's what I just love about dermatology. Well, there's lots of things I love about being a dermatologist, but I think probably the thing that I derive the most sort of personal benefit from is the help that I give patients in my vulval dermatology clinics. Um, Patients with vulval or genital skin conditions in general really often suffer for a long period of time before they seek help, either from their local doctor or eventually from me. And the problem with vulval skin conditions is that it can be very itchy, it can be very painful, it can feel very embarrassing, and also many patients are really scared about what's going on and what those symptoms might mean. They're scared to come forward, I think, because it feels embarrassing and so they suffer for a really long period of time before they seek help. And also, these kind of problems don't just affect the patient; they affect their social lives. They particularly affect patients in terms of intimacy, sexual relationships, and that can have a really bad impact on patients in all manner of their day-to-day lives. And so, the thing I find most rewarding is that actually I get to help patients who are really suffering, and often what I can provide is actually some fairly simple solutions that really make a difference, and not only to their symptoms, such as feeling less itchy or feeling less pain, but also in their social relationships, their intimate relationships, and their day-to-day life. And knowing that I can help people with these problems, it just brings me so much joy. Well, this is a really interesting question, and not one that I've thought about much, but I think what patients find about me and what they value about me is that I am a really friendly, easygoing, open sort of person. And patients, when we sit down together, I like patients to feel as though they can tell me anything that they want to. Nothing is off limits or too personal or too nothing should be embarrassing at all, really. And so I think I'd like to think that patients value that openness that we can have together. And on the flip side of that, I really value the trust that patients put in me. Um, it's not that common that we talk openly about, particularly genital problems, that we talk openly with another person about the impact that vulval itch or pain or discomfort or pain with sex can have on a person. And so I really value that a person who I've never met before can come and talk to me, and hopefully we can work through these problems together. But that person is entrusting me with some really personal information, and I really do value that. That is a big step to take, and so that's something that I always strive to make sure that I honour the information that patients tell me, and that's what I get value from. A catchphrase that comes to mind is that I give patients the time that they need. And what that means to me is that I like patients to leave the clinic feeling that they've had the opportunity to talk through any questions that they might have, any niggling concerns that are at the back of their mind. They've had some time to actually come to bring that up and to talk through it. It does sometimes mean we run a little bit late in my clinic, but at least I like to think at the end of the day, I've given every patient the time that they need to feel better and to go forward feeling confident about their diagnosis and their treatment plan.